Could you talk a little bit about the symptoms? So, what are some of the things that the guys should look out for?
What's interesting is that oftentimes when we diagnose prostate cancer, a man has no symptoms. Before the widespread use of PSA, really we were diagnosing prostate cancer at a much later stage. So while we didn't find a lot of kind of those low or slow growing cancers, when we did diagnose a man with prostate cancer, it's pretty advanced. So really oftentimes when we screen for prostate cancer right now, a man has no symptoms. And that's the whole point of screening, checking a blood test or an x-ray or doing something when a person has no symptoms. If a man was to have symptoms, that could be kind of a sudden change of their urinary symptoms, meaning peeing a lot more, getting up at night, some bleeding and things like that. But one of the challenges is that men, as they get older, their prostates grow. They don't have prostate cancer, but they have something called benign prostate hyperplasia, what we call BPH. And 50% of men at the age of 50, 60% at 60, 70 at 70, and so forth, will get some degree of prostate growth. And those men have some urinary troubles, and that doesn't mean they have prostate cancer. But usually if it's bothersome enough, they bring it up to their primary doctor. And I do think there is some overlap in terms of symptoms of prostate cancer. So we do recommend PSA, at least I do recommend PSA check and prostate, a finger exam at the bottom, or what we call the digital rectal exam, to make sure there's no hard spots on the prostate and to make sure prostate cancer isn't causing some of those symptoms. Mm-hmm. In its more advanced stages, people can have bleeding or can't urinate at all, or pain in the bones or other areas that it spreads to organs. But luckily, we can find most prostate cancer much earlier than that if we actively screen for prostate cancer.